Today, we are having a very transparent and direct conversation on curative therapies, the good, the bad, and the ugly. So what we have noticed is that when we have this conversation, it doesn't always feel very transparent. And I say that as someone that is actively seeking a bone marrow transplant. Some of you know my story, others might not, that I had a donor, was a complete stranger match. And about 2 days prior to when I was meant to check in for the transplant, I became sick, went into sickle crisis. They reached out to my donor, and my donor said they would no longer be available until the year 2023. What led to that is beyond me. I do not blame my donor in the slightest, but it was quite the blow. But here's the thing, while preparing for the curative therapies, there was so much that I feel got skipped, and there was a lot of things that we didn't discuss. And I want us to talk about that and to be able to discuss it fully and openly. Curative therapies, the good, the bad, and the ugly. We are joined by Heather Avant, our moderator, and she is joined by Deepika Darbari. Dr. Darbari has education. I first heard a talk on persistent pain post-stem cell transplant. I personally don't believe that we do a good job of managing expectations when it comes to curative therapies. The curative therapy does not mean that all of the previous symptoms and side effects and damage, tissue damage, bone damage is just gone. It just means hopefully it will not worsen. Sickle cell is a progressive disease, and each piles on top of what came before. The goal is to stop that with curative therapies, but it doesn't get rid of the damage that came before. So I'm very grateful for Dr. Darbari for joining us to talk about persistent pain, post-stem cell transplant, and other information. We are also joined by Warrior Genesis Jones, who has recently completed a transplant and has reached out to us to share her experience and stories. Doris Bailey, my mother, who recently went through the entire process with me and voiced a number of concerns. We're joined by Jamie Roque, a caregiver, and Rena Bishop, also an individual that has gone through and has, I will let everyone introduce themselves. So I'm going to turn this over now to our moderator, Heather Avant, to say a few words and to then introduce our discussion leaders, have them say something about themselves, and we're going to get into the discussion. As a reminder, it is a discussion, so we encourage those of you here in the audience, participants, type your questions in, raise your hand if you want to verbally speak your comments, and let's discuss this, curative therapies, good, bad, and ugly. Heather Avant, I'm turning it over to you.
Good afternoon, everyone. As Dr. Bailey says, my name is Heather Avant. I am currently the chair of the community input panels for the Cure Sickle Cell Initiative through the NHLBI. And I am happy to be with you here this evening. So let's get started. I'm going to start off with introductions, and I want you guys can introduce yourselves, and we can start with Jamie.
My name is Jamie Roque. I live in the Dallas-Fort Worth area. I have 2 boys with sickle cell disease, SE. They're 14 and 10. And I also have a small organization for kids affected by sickle cell, whether they have the disease themselves, trait, or they're a sibling or a child of somebody with the disease. And I'm very honored to be a part of this discussion. Thank you.
And next, Dr. Darbari.
Yeah, hi, good afternoon. I'm Deepika Darbari, and I'm a pediatric hematologist working at Children's National and take care of kids up to and young adults with sickle cell disease. Thank you for having me, really appreciate it.
Thank you for being here. And I would be remiss to point out Mrs. Bailey, but we'll call her Mama Bailey because that is how she is known amongst the Warriors. So Mama Bailey, if you would like to introduce yourself.
You're muted. We can't hear you well. Do you have anything connected that's keeping the mic? I'm going to come up and try to see if I can help. We'll go on to the next. Thank you.
All right. Genesis Jones, would you like to introduce yourself?
Okay, yes. My name is Genesis Jones. I am a sickle cell warrior that just went through a haploid identical transplant, and I am also a student and am happy to be here.
Great. And is Rena Bishop on?
She has not arrived just yet.
All right. Well, thank you guys. Welcome. And I believe it's time to get the conversation started. So we're talking about, as Dr. Bailey said, we are talking about the good, the bad, and the ugly when it comes to curative therapies. So we can start off with, if Dr. Darby would just go into a brief kind of definition of what, I know it's a huge bucket and it's a massive thing to kind of say, but what is a curative therapy?
Okay. So I just want to say, hopefully people have attended Dr. Fisipe's presentation earlier, and she did an excellent job of presenting different options. So whenever we think of therapies for sickle cell disease, one is like, disease modifying therapy. So you are trying to modify the disease itself. The second option or the second venue is called curative therapies. So what curative therapies mean is you are cured of sickle cell. That's the intent of these therapies. So really the person, if these therapies are successful, the person should not have sickle cell disease.
Thank you. Thank you for the brief definition. I really appreciate it. Alrighty, and we're going to go over something. I actually took a poll prior to this session, and I asked if anyone knew what conditioning is before you go into curative therapies, and it was an overwhelmingly no. It was 80% people don't know what what conditioning is. Can you explain to us a little bit about what conditioning is prior to curative therapy?
So the conditioning is like, if you think about sickle cell, all the cells, so our bone marrows, which are inside the bone, those are the factories of all our cells. So all the blood is made there. So a person who has sickle cell, their bone marrows are making sickle cell, the cells that have sickle hemoglobin. So in order for when they get the curative therapy, for example, like the stem cell, meaning like bone marrow transplant or gene therapy, so they get these new stem cells. These are really the cells in your bone marrow. They make all these blood cells. So when you get these new cells, you have to get rid of old cells. Those are in your marrow. So you can think about like a parking lot. So if a parking lot is full and you want to go in and park your car, there's no space. So you need to make space in that parking garage so this new cars can get in. So similarly, in our bone marrow, we have to remove some of these old cells which are already there so that the new cells you are getting from the transplant or gene therapy, they can go in and find the space and proliferate. Does that make sense?
Yes, it does. Thank you for your brief explanation of that. I'm going to take the conversation to Genesis Jones. Genesis, I know that you recently went through a curative therapy yourself, and I would like you to kind of give us a brief overview of kind of the process that you went through with conditioning and some of the things that you didn't know that were going to happen with your curative therapy trial.
Yeah, so I went through conditioning about 1 to 2.5 months before I received my cells. And the process is about a full workup of my body. And then before that, after that, I started my chemotherapy, and that was 21 days. And then I got 21 days after I finished my chemotherapy, I received my full body radiation, which is 2 days before I received my stem cells. And something I didn't know going through the process was, just how tired your body is going through the process of the chemo and everything, and kind of the after effects of the radiation itself, like how my body, like my whole body, I slothed my skin after the radiation. That's something that I wasn't aware of, but I mean, you see that I'm fine now, but that was something that I wasn't aware of, and that was kind of the only thing that they didn't make aware, and yeah, that was the biggest thing.
That was your biggest surprise. And Dr. Bailey, I know that you went through a lot of the process. And can you talk to us about a little bit about your process going into curative therapies as well? Because I know that you had some pitfalls.
Oh, absolutely. What I knew was coming and I wanted to be prepared for was going to be the mental health side of this. I knew I was going to go through. I know myself well enough to know that I was going to suffer for that substantially. I knew what conditioning was. I knew, and I think I might be a little of an outlier because this is something that I have studied extensively and done doctorate degrees in these fields. And so I knew what it was. I knew that I would need to do a lot of things. And I knew that the curative therapies as they stand right now would leave me infertile. But I also knew that that would be a lot to deal with. I knew a lot of the things, but I would have to say that even with as much as I know, there were still moments when it was just, wait, I'm sorry, what? This is going to, I'm sorry, say that again. And there were moments when they were like, please here, sign all of these papers. And if I didn't know, I would have thought I was mandated to sign everything in that consenting process. It's really only the first two. The rest of that were studies. And I don't think they did a good job of explaining, this is for us to transplant you. These are all the different things we want to study while we're transplanting you. And you're not mandated to sign any of that to do the first. And so there were just things in that whole process that I didn't feel like were clear. And I had a difficult time with. And so I want to be very brief. I'll stop right there, but there's so much to talk about when it comes to that.
I want to kind of go to your mom. I don't know if we can hear her now, but Mama Bailey, can we hear you? Yes, yes, we can.
Good. Fantastic. Fantastic.
I want to hear what are some of your main concerns? Because I know that you had many concerns with Dr. Bailey or with Lakia going into the study. So can you tell us some of your main concerns?
Well, some of my concerns was that we didn't know up front the things we needed to get done to make sure that Lakia would be successful after the process, after she had the bone marrow transplant. Going home, your home needs to be set up in such a way that there's nothing that could cause her to get any type of fungus infection. You know, we need to change our carpet, change our flooring, the whole 9 yards. And then I was also concerned with where we would stay. Right when she first came home from the hospital, we had problems trying to find some place for her to be. Since we lived too far from the hospital, we would need to move into another place. And I was concerned about that particular place because if I need to make sure my home is correct, my home is in order, that she wouldn't have a problem. How do I know the place that I'm going into, whatever hotel or whatever apartment that I rented, that everything was in place there for her? So I was concerned about that. I had some concerns I didn't know initially, I guess I should have, but just didn't think about the fact that even her blood can change. Become the blood of the donor, have the same type. It was just little things, the blood type, right? It was just little things I didn't know about that I had some concerns about. And then I wanted to make sure that Lakia was okay in the process, making sure that she had eggs in place so if she wanted to have children later, she could. We didn't know, just different things we didn't know up front that as we talked about and learned more, I just had a lot of concerns because the end result is I wanted her to be healthy. I wanted her to be everything to be fantastic. And when this process is completely over, it should be the same Lakia, you know, same smartness, whole 9 yards. And I'm sure that won't change. But those just questions and concerns that I had.
I think that those questions and concerns are very, very fair, especially as a parent. And as a parent, I'm going to move over into Jamie, and I want Jamie to talk about some of the thoughts that she had in discussing, or even thoughts about curative therapies as a whole in regards to being a mom and a parent. Jamie?
Well, I'll try not to take up the whole hour. My kids are much younger than Genesis and Dr. Bailey, and they're 10 and 14. And a lot of times, like everybody's been saying, when you hear about these curative therapies on the news or in conferences, it's all rainbows and puppy dogs, and you don't hear the other side of the coin. You don't hear the possibility of sterilization. You don't hear the possibility of secondary cancer or death, or of it failing, or of it working for a while and then reversing, or having to take medication the rest of your life to avoid rejecting the donor marrow. And as a parent, I can't make those decisions for my kids. I can't justify putting my kids through chemo and potentially giving them all these side effects. To me, it needs to be their decision. They need to weigh the pros and the cons and decide if the side effects are worth it, if the risk of the side effects are worth it. You're not necessarily going to get the side effects, but as a potential. So that's kind of where I'm at on this journey, just educating my kids what their options are, what it really looks like realistically, so that they can make an informed decision when they're adults, whether they want to do it or not.
Thank you. And that kind of takes me, now I want to talk a little bit about, I want to move that back over to Genesis, because Genesis is a young adult and she made an informed decision as a young adult. And she started the process, I believe, when she was 18. So I'll let her tell you a little bit about her decision to start that process. And Genesis, do you want to talk about that?
Yeah, so I did start at 20. I started the process of moving forward with the transplant, and going back on what everybody's saying about not knowing those decisions that you have to make at such a young age. And a lot of people don't know that I went through egg freezing, because that's something that you don't think about when going through chemo, possibility of, not being able to have kids after the chemo. And that was pretty hard, going through the hormone shots, and then going through the egg harvesting itself. And that was a lot to go through, and you have to do, that's also part of your preparation before you start you give your cells. So that was something I did before I started my chemo, obviously, and that was a huge decision to make at such a young age, because of course I know that it was the best decision, but it was just something I didn't think about at such a young age. And that was the biggest. And then coming back to the end of the transplant, I went through my transplant, and I found out that, I had complications from the transplant itself, and I found I had post-transplant lymphoma. And that was another decision that, going into this, I didn't know that that was something that I could have or get, and that was a complication from the transplant itself. So it's just a lot of things you have to think about, and, decide whether that pain from the sickle cell is something that you want to outweigh those risks and move forward from there.
Thank you, Genesis, for sharing. So this kind of leads us into another topic, because I'm not going to put you on the spot, but you're kind of on the spot. I want to talk a little bit about mental health, because this is a big, huge factor that is oftentimes left on the cutting room floor. it's a very brief subject. It's a very briefly touched on. I am in a battle with a lot of different doctors right now about mental health and curative therapies. And Dr. Bailey knows that me and her have decided to go to war. So we've been in battle for a mental health initiative of some sort in regards to curative therapies. So I am actually going to let Dr. Bailey talk a little bit about that, because she did touch on her mental health in regards to her fertility. And if you can take it away, Dr. Bailey.
Awesome. Yeah, I certainly can. And see, the thing is about it is, this is a big decision, and I so respect and appreciate Jamie Roquet's point about not being comfortable making that decision for her children. And I struggle in that area because, when you're younger, before all the damage sets in, it is the best time to get a transplant before all the damage. But this is a difficult decision. And how could a parent make that? I get that and how hard that would be. And a big piece of that for me was getting to the point where I accepted needing a transplant. That required a lot with my mental health. Getting to the point where I was ready to actually pull the trigger. That was draining on the mental health. Doing everything you have to do to prepare. And as a woman, it's much harder to preserve your fertility than it is for men post-puberty. And so getting to that part was a big part of my mental health. And all of it, every single step, you don't talk about this much. Before you get the transplant, you have to have perfect teeth. Any tooth that has a problem has to be pulled or fixed, because you can't risk any dental work while you have no immune system. And so your teeth a dentist has to sign off. And all of the steps that lead up to it, for me personally, it was a drain on my mental health. I decided to preserve eggs as well, oocyte retrieval, not because I was trying to have children personally. I'm much, much older than Genesis. It was more of just protecting my mental health, because I didn't know how it would affect me coming out of this system, knowing that I no longer could. And I didn't find support in that area. Even though I was attempting to go through a trial, I kept saying, mental health, this should be something. And I had to ask repeatedly, will I be able to access mental health support? And they were like, well, we have someone that talks to our cancer patients, but there was never anything concrete. This is who you will access, except through Be the Match, who has mental health teams that you can reach out to. And shout out to Be the Match, because they do a lot of support with sickle cell that no one else does. And I can tell you that I shed a lot of tears leading up to it, making the decision. And there were a lot of tears when it all fell apart. So I don't know how all to get into it. And I am not a mental health expert to go into why it is. I just know that it is, and that my mental health was severely affected. And this is pre actually doing the transplant.
Right. Okay, Dr. Dabari, I would love to hear what you have to say in regards to that, because I know that you see patients on the other end of it, and probably somewhat during it. So I would love to hear your thoughts.
Yeah, so I was listening and I completely agree. I mean, it's a major decision to go for transplant, and it's a very personal decision, because sometimes we have parents who a child is just like 9-month-old, and the first question is, when can we have transplant? On the other hand, you will have individuals, they don't want transplant. And there'll be some individuals who would be like, they didn't want transplant, but now they want transplant. So I think very, very important thing is communication with your team. And there are different kind of teams. So very important that, first of all, see what resources you have, the center where you are, because when you are at a center, you want to make sure all the resources are there. So going back to like consent and talking about transplant, I think and I agree what you said, Heather, when people hear cure, they don't hear anything after that. They're like, oh, my child would be cured. But other things, the whole process, it's so important to understand and have the correct expectation, because it's not like, it's like taking a antibiotic, right? It's not like taking penicillin and you'll be done. It's a long road. So it's very, very important to understand. So I think communication is really the key thing. you talk to your team, you see who are the psychologists. Social workers are so important because sometimes physicians talk to patients or families in a language that person may not really understand what they are saying. So having a social work there who can really translate and make you understand, or do you want to ask this question? Maybe you should be asking this way to get the correct answer. So it's very important to have your team where a person can work as your advocate. And at any point, if you don't feel comfortable or if you have more questions, I think no one would mind at all if you want to get second opinion. Am I a good patient for transplant? Am I a good person for transplant or not? Would other places transplant me if this is my history? So that you can always do that. And about the consent, and these days consent, I mean, when we get consents, they are like, when I read it, I generally tell them these are like 15-20 pages. Who has energy to go through? Like, if I'm a patient, I would think twice before signing because I don't know what I'm signing for. Because it's just the intent is fine, but it has become so complicated. These are generally like approved by so many other people that it's just difficult to understand. So my suggestion would be, if you're considering that, take the consent with you home. Read well, underline what you don't understand, and have multiple meetings. So once you say like, or once you decide, okay, I want to go for transplant, and I think it's important to talk to your hematologist that these are my problems. What do you think? I have this match or I don't have a match. Do you think it is a good idea for me? So you start there talking to your primary hematologist. Then you set up a meeting with the transplant team, go over with all the question, who is in their team, what would be the process, learn all the details about that. Because in the end, as I said, transplant is not a benign thing. It's not like taking penicillin. So you should understand and really learn about what are the complications, because you don't want complications to be more than your disease. You don't want to end up having disease which is worse than your sickle cell disease. So it's important, and there are different factors, like based on different studies, we know what are some of the risk factors that may have bad outcomes. So have real expectation, what are outcomes. It can range from like total cure to really death. It can range from any like point A to point B. So it's important to understand what are the possibilities and what are the things you will need. Like, Dr. Bailey said, having that, having your dental work done, your general health, everything matters. So, each person is different, we know, and it's very, very important to communicate with your primary team.
Thank you for that. I think that was, it was definitely needed and necessary for the community to hear. I'm going to kind of actually take this conversation back to Genesis, because I kind of want to know what were some of the, since you just kind of went through this, what were kind of some of the conversations that you had with healthcare providers in regards to your mental health before going into your trial?
So I met with an initial visit before I started everything that I went through for my transplant. It was a psychologist, their therapist team, and it was kind of to see if I was, apt to go through the transplant itself. And then I asked them, would there be somebody that would be alongside me do the transplant while I was going through it, because that was very important to me, because I've had other issues with mental health in the past, and I wanted to make sure going through a process like this that somebody was there to take part of the mental health. And they told me that that there would be somebody that would work with me weekly or a month-to-month basis on my mental health. And I thought that was good, but I know that not every program has somebody that is alongside every warrior, or somebody helping them do their mental health aspect as they should be. And I think that's such a huge aspect when you're going through a transplant, because your mental health is such a huge component to not only your physical health, but your mental health is the biggest thing that I think you need to keep strong and keep viable. Not only your physical component, but your mental health needs to be the biggest thing that you try to keep building up. And then I kept that strong, my physical component, and making sure that I had my family support team. Um, so that was, yeah.
And there is a question for you, Genesis, that's in the chat, and it says, was it all worth it?
I would say that being at this point, it was all worth it, because I'm not in and out of the hospital like I was before. I'm not having to go to the plain clinic, and I don't wake up with that pain that I had from the moment I woke up to the moment I went to sleep. And I'm talking about that sickle cell pain that you guys know I'm talking about. It's no longer there, and it took a while to get to this point, but I can say that I don't have that pain anymore, which is a blessing to be able to say. So yes, it was worth it.
Okay, and one more question. It says, were you able to access a therapist on demand?
Yes, if I needed to access a therapist, like if I was on crisis or needed to talk to someone, I could know that there was somebody there, or they would be there within an hour or two.
And you said that you had a support system, you had a familial support system while you were going through curative therapy. Who was with you and how did they help you?
So I had my mom, which was my donor, and then my grandma, that were there throughout the whole transplant. And then of course my family that lives here in the DFW area was supporting from afar, because I had my transplant in Maryland, Bethesda, Maryland, at NIH. So it was not in the Dallas area.
All right, great. So I want to keep the conversation going. We've talked a little bit about the bad and and the ugly. So let's talk a little bit about the good, because there are some good, and you have kind of shined a light on some of the good that has happened in curative therapy. And I want to kind of move this over to Dr. Bailey, because Dr. Bailey had some good to get out of having curative therapies. So I'm going to ask you to share with us the good that you were going into, and the hope that you had going into curative therapies.
You know, I may not be the best to ask that question.
I'm gonna ask.
It really became more of, it wasn't so much of, yay, I'm going to be cured. It was more of a, yay, I am out of options. So here we go. My health had gotten to the point and has gotten to the point where it is becoming abundantly clear that I need to do something. And so in order to give myself my best chance, it has been a change of diet. It has been meeting with Dr. Marjorie for my regular yoga. It's been meeting with Clayton for mental health checkups. It's been hanging out with my babies because they make me happy. And it also has to be, I'm on all the medications. So if you were in the therapeutics and you heard Dr. Titi Fasipe talk about the 4 different drugs that are approved, I am on all of them. But the transplant is where I was looking to next, because I am 42 and the health has been very bad for me. And so I guess my good was to stop the progression. It wasn't that someone asked me, did you always want a transplant? No, absolutely not. I never wanted a transplant, but I'm grateful that it is an option that I can look to. And that's really my good, that it is there, it's an option. Things have gotten so much better than they used to be, and it can stop the progression of this disease. And that's the biggest piece for me.
Yeah. I'm gonna move, excuse me, I am losing my voice. I am going to move the conversation over to Jamie. I want you to give us some feedback on progressive disease, because sickle cell is a progressive disease, and I have heard you speak on your children, and if you could talk about how your children are going to age and how that kind of impacts you as a mother and what that looks like in regards to the progression of their sickle cell as they age.
Yeah, for me, I don't really like the word cure when we're talking about these therapies, because to me that implies they're not going to have any more pain, any more complications. And when I look at my two children, they're only 14 and 10. And one of them has had so many pain crises in his right arm that he can't even comb his own hair, can't even hold a fork, can only write 2 sentences. His handwriting's completely illegible. And my other child has had silent strokes and has a lot of cognitive deficits as a result. And I think if today I were to get them a bone marrow transplant, these issues are not going to go away. They're going to still have the tissue damage. They're still going to have the cognitive deficit, and it's not just magically going to go away. Like Dr. Bailey said, it would put a cap on it, hopefully. Hopefully they wouldn't have the side effects. But to me, a cure is something that happens as young as possible. And, I don't know if in utero's even on anybody's radar, but that's where I'm thinking a cure would really truly happen. And so, I've always had a problem calling bone marrow transplant, gene editing, gene therapy a cure, because to me they're still going to have that chronic pain, and they're still going to have lingering effects from the disease. You're
Sorry,
muted,
I'm
Heather.
muted. Mama Bailey, Mama Bailey, I see you over there nodding your head. So we're gonna move the conversation over to you in regards to that last comment that Jamie made. You were shaking your head about the cure. So can you give us a little comment and talk to us about your thoughts on the cure?
Well, the cure, bone marrow transplant and so forth is wonderful. I'm very happy that we have that we can look forward to. When I think about it, I think about the lingering effects that Jamie spoke of, about whatever has occurred in your body, whatever damage has occurred, it's not going away behind having a transplant. If you had lung issues, heart issues, whatever, they're still there. So that's something you still have to deal with. And this ideal also, there may be residual pain, still having a crisis, but not actually having a crisis, but your mind telling you that you're still having the pain. So those are some things that I think about, and the things that we have to realize that could occur. That behind the cure, it may not be a cure, but but everything stops, like I said, like Jamie indicated, that if you had some issues with your heart, your lungs, your liver, it stops at that point, There's no more damage being done, but the damage that was done is still there. But I'm grateful for the fact that there is a bone marrow transplant, there is curative therapies, there's things that can be done. Because like Lakia said, at this point, we're glad that there is something else that can be done, that you can continue to live and live your life to the fullest. Grateful for that.
I agree 100%. While I understand Jamie's take on, quote unquote, the cure, I'm a firm believer in the fact that this is a new horizon for us. It's offering options that we have never had before. And of course, with those options become more options. So we have to think about this as just being the beginning. So I am definitely excited about this new horizon that we're facing as sickle cell warriors, because I know for me, I know that I am not eligible for a cure as I am in my 40s, but I know that the idea is exciting, that, the work that we're doing today, the people who are coming behind, the children who are coming behind us, and even the babies who are unborn yet, will have an option of having a curative therapy and a cure. Okay, Dr. Dabari.
Yeah, I just want to say, so I agree with everyone who said like having this option is really a blessing because, and I also want to say that, there are excellent results as well. It's not like, everyone who has a transplant would have problem, which, and especially in young kids when, in the pediatric age group, results are very good because age is really a factor that plays very important role. And I also want to say about the pain, a lot of patients, so even in our study, when we looked at with whose pain got better and whose pain did not get better. So they were like people who, or the individuals who were like younger, had less pain, they did much better. So, I mean, I think having, if someone has avascular necrosis of hip, transplant is not going to fix that. Transplant would prevent the further progression, as Dr. Bailey said. So a lot of these things, so young kids, when before they have all these other issues related to sickle cell, ongoing sickle cell damage, I think that helps. Second thing is also for younger kids when they are, or even if they're considering transplant down the road, it's important to do anything that can be done to prevent the damage from sickle cell. So if it's an option like hydroxyurea too, so any of those disease modifying therapy that can keep your sickle cell in check. I think that's very important. So when you decide to go for transplant, you don't have a lot of, these problems that maybe they may not improve with transplant.
Yes, I understand that is, it's profound. It's true, but it's profound. Catching them young. It sounds crazy, but but that's also, there's like a juxtaposition there, right? Where you have Jamie's point of, making a decision for your child. So I could see how parents would struggle with that balance.
Yes, I agree 100%. And in pediatric, I think that becomes bigger of a problem. If you're adult, you're deciding for yourself. And when you have child, then it's deciding for child, and hopefully child would agree with you or not. Like, it's hard. And I mean, it's a very, very difficult decision because there's so many unknowns. I mean, if someone can say, okay, you do this and everything would be fine, but it's not, we are not there yet. Like, everything is not, no one can say 100% it will be all good. So that's the problem.
And Jamie?
Yeah, I just wanted to add, we've said a lot of, I think, more of the negative things towards curative therapies. And I think what's important to say is that, each person's just navigating their own way through sickle cell. And you have to do your part and educate yourself, listen to these discussions, and really weigh it for yourself and for your family and make the best decision for you and your family. I was telling Heather earlier in the week, I have a friend who, when they found out their son had sickle cell disease, they decided to go through IVF. They're, financially able to go through IVF, and they on purpose chose embryos that were 100% matched so that that child with sickle cell disease would have a perfect match when he was older. And he just went through a bone marrow transplant using his brother. And they're able to do that. Not everybody is able to do that, but I think it's important to support everybody's decision, whether they decide to do one of these therapies or not decide to do it. And I think the key is really educating yourself, weighing the pros and cons, and making the best decision for you and your family.
So it relates back to curative therapies are a very personal decision. And there's no one way or one route that's going to be, it's not the cure for everyone. That's why they're in trials, and they're clinical trials. Dr. Bailey, would you like to speak?
I think that had it been an option for me, I would have much rather done this while I was young. I would have wanted to have had it personally while I was still healthy enough for it to have mattered. And now it does matter. I don't mean to suggest it wouldn't, but now I'm getting to the point where I'm too old. I'm aging out. It was my last shot, and they might still find a donor and push me on in. I was going to be their oldest transplant recipient for this cohort. But I will say that if I could have done it as a child, I would have wanted to. I recognize that it would have changed my entire story, right? Not having sickle cell. I think that's another thing that we have to learn to discuss and talk about. What will that mean when this has become so big of a part of our identity? And I've heard from those that have undergone curative therapies that that part was hard. Who am I if I'm no longer a warrior? What else am I if I'm no longer an advocate? I don't think you have to be a warrior to be an advocate first, but it is a big part of the identity. And so I recognize it would have changed my entire story. Who knows if I would have started the consortium? Who knows if we'd be here in an 8th annual virtual if I had been cured at 3 and had done something different. But I do know health-wise, if I could have a choice, I would rather have done this while I was younger. They talk about how resilient children are. While I was young and resilient and active and could get out the hospital and go outside and play the very next day. Now when I get out the hospital, I need to lay down for about 2 weeks. So that is something that is just something that I would have done to be entirely transparent, to be entirely transplanted as well. But that is something I would have done. I do, though, recognize, and I fully believe things happen as they're meant. So although it does hurt my heart that I didn't get the transplant, I also think that on some level, I must not have been meant to, you know?
That's very powerful. Very, very powerful. So we have about 12 minutes left, and I want to see if we have any questions. I can only see the questions that are in Zoom. Can anyone else see the questions that are in Huva?
I'll take a look and pull those up right now.
And if you have any questions at this time, it's kind of the time to ask.
I have a question, but I didn't know if it was appropriate just to unmute like that. So
yes, please ask. It is a community conversation.
So I guess this is for all the warriors on the panel. So I know that Genesis said that she went through the process when she was 20. And I guess what I'm wondering as a caregiver and an older sister of a warrior, how do you help prepare your siblings to go through the process? I know we talked about a lot of like the hurdles, and also how do you have to make it an informed decision, like if they wanted to do it in young adulthood, if the parent didn't make that decision in childhood to do the bone marrow transplant?
Does Dr. Bailey or Genesis want to take this one? They said the warriors on the panel. Unfortunately, I have not gone through a curative therapy.
I haven't gone through it either. I think that leaves you, Genesis. That's a you. I haven't, I mean, I was going up to it, but I didn't actually do it. And also,
a question for you all would be like, what kind of was your thought process in young adulthood and not doing it then versus like in, I don't want to say elderhood because y'all are not like that old. So I don't know how to, the appropriate way to say that.
I get it. Well, I can tell you, as a young adult, I thought I was invincible. If you had asked 20-year-old me if I thought 40-year-old me's life would be where it is now, that my health would be where it is now, I would not have believed you. I didn't process that this disease is progressive. It didn't click for me at that age that every crisis I had was doing more damage. That as I came by and the disease took a hammer and banged on my bone, that bone didn't get fixed. And so the next time the hammer hit it, it did more damage. And the next time the hammer hit it, it did more damage. And you hit a wall enough times with the same hammer, it's going to start to crumble. I didn't process that. I thought my wall was just renewing itself. I didn't process that I was not, in fact, invincible, that I would not always be able to jump out of the hospital and go and, run the world. And so my mentality as a young adult was in a very different place than it is now. Had I known then what I know now, yeah, I would have done things differently. I would have sought it out. But of course, you also have to remember, I was born in the 70s. So 20 years ago, transplant wasn't where it is now. So the truth is that we have come so much further that, we have come so much farther. And so it's also a very different scenario for me. But Genesis, you're a young adult now. Maybe you can speak to that.
Yes, I agree with Dr. Bailey that sickle cell is a very progressive disease, unfortunately, and I was so fortunate to be able to get a transplant at the age of 21, and I'm so thankful and grateful. And I mean, I just say if you have the option and you are thinking about it, to get it as young as you can, because the years going on, you are just getting older, and sickle cell ages you, unfortunately. So I'd say if you're thinking about it, look into it and see if it's an option for you, and go for it and put those things in place. And just know that the further you get away from it or older, it's harder to do for sure. So yes.
Dr. Dabari, there is a question for you. It says you have encountered children who have come of age wanting to participate in therapy, and do they have any resentment that they didn't do it earlier? So have you encountered children who have come of age?
So I responded to that. I personally have not seen anyone who resented that parents didn't take them for transplant. But I have, on the other hand, I have had a few kids who, after they turned 18, they wanted to have transplant. So, but they were fine. Like, they never said like, oh, my parents should have done it or anything like that. But, there are actually quite a few I have seen that they opted for transplant. But I also want to bring up one thing, because it's very, very important for, especially for parents, to have this conversation with their hematologist, because there are certain complications in my mind. When one of my child has any of these problems, I would say it's time to consider transplant seriously. And then, so there are like absolute, like you should seriously think about it, versus like, it probably is a good idea. And it depends on so many things, like who's the match, who would transplant, what are the other circumstances. So it's really very individualized and personal decision on parents' behalf also. So I think first thing, if anyone is considering at all thinking of transplant or just want to explore, please talk to your hematologist.
Okay, we have a hand raised by KW Young. If you could unmute yourself and ask your question.
A quick question for Dr. Bailey. Dr. Your compliment. How do you do all that you do and continue doing more? And finally, has anyone heard of any options globally where they are transplanting people normally in their 40s? I believe in the Middle East, in a country called Oman, there may be some options there. I've heard it talked about. I'm not quite sure the details. So those are two questions.
I think the first question was, how do I, can you repeat it for
Do
me?
all that you do.
How do you continue to do all that you do, Dr. Bailey? even while you're
We
not
all
well.
ask that question. We all ask that question on a daily
I've
basis.
seen you in
all
hospital
of us.
planning this conference.
A lot of help, a lot of prayer, and perhaps a touch of insanity. Just being a little crazy and having surrounded by a very crazy team and just pushing through. Lots of prayer and lots of help.
We love y'all kind of crazy.
Thank you, Mia.
That's a great question, because we've all asked that at some point. And one more question, Yvonne Carroll, before it's
I'm
time
sorry,
for
he
us to
said
close
something
out.
about transplanting in the
Oh.
40s and whether or not that was also an option. So I'm 42 and I had to get into the study before I turned 41. So I had 6 months to get approved and into the study, and it had to be done while I was still 40. No, I'm 43. Did I say 42? I had a birthday this month, a couple days ago. I'm 43. So, so I know that I had to get in while my age was still 40. I don't know about too many others in America, at least, that's doing it past that age. Not in sickle cell, anyway. You hear of like 60, 70-year-olds with cancer getting these kinds of transplants. I know of someone's father who got one, but I don't know of anyone with sickle cell in that age group getting transplants. Yvonne Carroll, sorry.
It's okay.
Yvonne Carroll, you'll need to unmute.
Maybe we
don't.
lost her.
You may. Oh, there we go.
Oh, there she is.
We
Maybe
can't
not.
hear you.
You're speaking to me?
No,
No,
it's
Yvonne
Yvonne, but I
Carroll.
don't think we can hear you, Yvonne. Heather,
All right,
I
well,
know
I
it's
guess we have
5:57, but you do have
3
a number of
minutes.
questions online. Yeah,
Do we really?
you'd have
Oh,
a lot
gosh.
of questions online, but I think that's where these have been going, that we run out of time and have lots and lots of questions. Rena Bishop did join us and she is on the call. So maybe you want to wrap up with a comment from her. She was a
Yes,
bit mistaken.
absolutely. Rena, if you can unmute yourself, can you please introduce yourself and tell us a little bit about yourself and a brief kind of overview of your story dealing with curative therapy.
Okay. Hi everybody. I do apologize being late. Different time zones, got confused. Basically, my son had a bone marrow transplant 8 years ago. He had to get a transplant. We were kind of left with that option. First crisis was at 3 months, and between 3 months and 6 years old, he had 4 strokes, iron overload, just a series of issues with sickle cell. Like anything you can think of, he pretty much experienced. We were living in Milwaukee, moved to Indiana, then ended up moving to California because just chasing the best hematologist. And through the series, they just wanted to numb him. So Keelan didn't start speaking until he's about 3 and didn't walk till he's about 3.5. Like he was so medicated because they just wanted to stop his pain, but didn't think about anything else. You know, so long story, as much as I can get in this little minute, he's fully healed from sickle cell. He does have a low platelet disorder called ITP, which is the side effect of the medications that he had during his transplant. The road was very up and down. Overall, I'm thankful that we did it. But the experience itself has impacted us tremendously, you know, and he still, like I said, still has a low platelet disorder, but no sickle cell. But he has to get platelets every now and then. His range is about, his normal is 25 to 40,000. As we know, that's nothing, you know, so whenever he wants to fly, we got to get juiced up to get over 100. You know, no active sports, no physical contact sports, nothing, you know, but still better than sickle cell. But the ITP is something that they don't foresee like going away. You know, no medication for it. He's not on anything right now. Recently, he started steroids, but that was like 3 days ago. So we'll see how that goes. But yeah, I'm open for questions. I know we're about to end, but just email me or Facebook, anything. Thank you.
Can I add one point as well? Thank you so much, Rena. And I'm sorry about that time zone difference. I would
That was
love
on
to
me.
connect with you again. And that you have a video journal on YouTube with your son's journey. So I would encourage everyone to please go and check that out. I do want to add one thing. My mother made a very interesting point that I think it's important that those involved in these transplant studies and providers. So I was asked the question, no, I didn't feel like I was supported by my transplant team. I felt like they were rushing me. I felt like it was, come on, do this, you need to do this, you're going, and I did not appreciate that. And it was me that put a halt into it the first time because they were still trying to get me to transplant. And we were in the middle of a literal pandemic that no one foresaw coming, and we still didn't have hospital protocols on how to do it. I was supposed to get my transplant in April. The pandemic, had just officially started. I put that on hold. You want me to be without an immune system during an actual global pandemic. It made no sense to me. I felt like I was being rushed. So did I feel supported? No, I didn't. But my mother made a very interesting point. Because of the way that was handled and because of others that we've talked to, she said that it felt to her like some of these people were more interested in getting us enrolled in their study than actually curing our disease. And that is a problem. If what we're getting from researchers, from doctors, is more about getting us in your study than actually curing us, not feeling supported, not having the support. There have been people that have had amazing experiences and they felt thoroughly supported, but get to be my age and see how supported you still feel. It seems to be a very big difference, and it's not okay. And I think that's something that we're going to need to talk about as well at some point, because it's 6:02. Rena Bishop has put some things that she's got in the chat. And so
Yes. I also wanted to say, I'm going to put a link to, if you guys want to check out more about Curative Therapies as a whole, Dr. Bailey and I both work with the Cure Initiative through the NHLBI. You guys can go and check out their website. They do have information on there about Curative Therapies and about some of the trials that are currently going on. I'll put the link in the chat so you all can get it. And I just want to say thank you to our panel. Thank you to our panelists. This was, I think, an amazing conversation. This conversation, though, can go on for like the next 7 years. And I would love to be a part of that, but I know we have to come to an end this evening. Dr. Bailey, do you have any parting words? I did cut you off.
Oh, no, that was it. Thank you all for joining us. We know that this is a conversation that could continue indefinitely, that the curative therapies process is much bigger than transplant. Of course, we know we're looking at gene editing, gene therapy. We've heard from CRISPR, we've heard from Bluebird, we've heard from different groups about all the different treatments they have available. Lots of interest in curative therapies as a whole, but very little out there about the education and what that means. So we're grateful to have been joined by various sponsors to talk to us more about that, particularly Bluebird and Vertex. And I think we need to go and check out the videos in the classroom, learn more about this, and continue these conversations.